Hello and welcome to Note to File, a clinical research podcast.
A collection of interviews, candid commentary, and general nonsense for the clinical research community.
Check us out at notetofilepodcast.com.
And now, without further ado, on to the show.
All right, hey guys, welcome to another Note to File live Sticky Notes edition. How's it going, Denali?
It's going. I don't know. I feel like I always say it. I've had a busy fucking day, but it's all right.
Well, it's what happens when you're super important, you know?
Yeah, I'm kind of a big deal. I don't know if you know this, but my apartment smells of leather-bound books and rich mahogany, so.
No. Please don't quote Anchorman. Anchorman?
Yeah, that's Anchorman. This is like good, like, I don't know, 10, 15-year quote.
Well, I mean, there were a run of like Will Ferrell movies during that time period, and sometimes
kind of all run together
to get them confused. I don't know. I may have liked Talladega Nights slightly better.
That's bold. I think I probably disagree with that pretty soundly. I did, but this is someone I did quote Anchorman in a job interview when they asked me what diversity was, and I did not get that job. But
I'm shocked to learn that.
Yeah.
Okay. Well, if you're watching, which is better, Talladega Nights or Anchorman? And if you say Anchorman, then
you're right.
Don't ever watch the show again, please.
No, you're correct, and you should always watch the show.
They're both good. They're both fine. I'll allow either opinion. Okay. Mm-hmm. Very good. Okay, well, today is September 25th, and actually, interestingly, today is National Research Administrator Day. I didn't know that. Founded in 2015 by the National Council of University Research Administrators. How kind of them to give themselves their own day.
So how would you classify a research administrator?
I don't know. It says here, research administrators and managers serve an important role in supporting research. They assist the faculty and researchers, protect the institution or organization, and assure sound stewardship of sponsored research dollars. Many organizations support research administration around the world. That's all there really is to
pretty
say.
Solidly AMC position.
It sounds like it. There's a section here that says how to observe Research Administrator Day. Take your favorite research administrator or manager to lunch to thank them for all they do. Share their success. Often their accomplishments help to move research forward. Take photos and post on social media using hashtag Research Administrator Day. So guys, please do that. I haven't seen that hashtag being used today, but I will point out today is also National Lobster Day. So maybe you should treat them to a lobster lunch.
I'm a big old fan of seafood, so not mad at that. Although Wisconsin's not like prime lobster.
No, that's hard to believe.
I know, it's weird.
No one have those in the Great Lakes or whatever up there. You know, not a lot of lobster.
Yeah, we got crawfish.
I mean, I'm pretty sure they didn't they like some places consider lobsters like it's a bug, right?
Yeah.
So there was a law that they couldn't serve lobsters to prisoners more than twice a week because it was considered cruel.
I feel like that was like maybe the start of that food trend of taking like the lowest food and then like elevating it. Like oxtail is like a really good example of this, where you take like the thing that like no one really wanted and like make it delicious and it becomes super commoditized. But I mean, generally, you think about like lobsters and shrimp and all of those, they're basically sea bugs.
They are, truly. It's good.
Delicious sea bugs.
This is what this podcast should be about, frankly. Turning this into a foodie-based podcast from this point
I mean,
on.
To be honest, that's one of the perks of like traveling to conferences and shit. And like, this is conference season, right? Like, but it's being able to eat all the different, like, I don't know, regional foods.
Yeah. No, that's a good point. Okay, so thank your research administrator. I assume they already eat lobster on a daily basis anyways, because, they're rich and powerful.
Take your research administrator to Red Lobster.
There you go. That works too. Okay, well, let's talk about some research stuff, shall we?
Sweet. That's good. Let's do it.
Maybe. Hold on. First one here. like a nice article from Dan Shell, who I think, I think we all probably share some of this sentiment in the industry. It's actually something I think I've been hearing a lot more of lately. The title, Seriously, Are We Making Any Progress? Which I thought was interesting and really seems to be, mostly about Dan, watching presentation from Ken Getz, who's
Probably a D-Farm, yeah.
Yep, at D-Farm, yeah. Who is the researcher of research.
Which is, I think, fascinating. I think that's a whole underlooked at field, but
yeah, well, I mean, he's definitely carved out a nice niche for himself. And it makes sense, right? Like we do all this research, but we're not always doing a lot of research on the research that we're doing, like how well does it actually work. And I think it is really fascinating. I wish I've had more time to like sit down and dig through some of it. So, but it sounds like they're coming out with some more stuff. Trying to see here things I found interesting that between 2012 and 2020, the total number of data points collected has increased 283%. That's good, right?
I mean, it's more.
And more is always better.
That's what I've heard. It is always quantity over quality.
Yeah, and this article goes on to talk a little bit about that. It's all the extra data and complexity worth it. I mean, it's hard to say. At least it's easy to say from the site side. It's certainly not worth it. Is it worth it for the sponsors? I don't know. And then maybe a little bit of hope in ICH E6 revision 3, which seems to, at least encourage that we're being more agile and flexible, which I guess it goes on to not really clearly define. But again, those
guidelines are, right?
Well, and look, we're not, there's no shortage of guidelines, but we don't really do the guidelines, do we? I mean, isn't that the problem?
Well, that's because they're guidelines. And so as an industry, we're fairly risk adverse generally, which is ironic considering our whole industry is based on risk. But if it's guidelines, I don't have to. I'm not going to be the first one to jump at it. I'm not going to be the one to do it because of all of the different, and I think we talked about, you change something in a guideline, you try it, but there's all of these other regulations that haven't also shifted. And it's so interconnected that if you try one thing new, it doesn't match with what anything else is done. So no one's incentivized to do it. And in fact, they may be de-incentivized because it creates more drag in the process.
I guess, but it just feels like we're going down a road where like we don't have a lot to lose by maybe trying something different. I mean, all we see are like
everything sucks. So why not?
Yeah, pretty much. Like if we get to a point where everything sucks bad enough, like why not roll the dice a little bit? Anyways, nice article. I always love Dan's work, so go check them out at Clinical Leader.
Well, it's an interesting concept about like more data points, because I think holistically as a reality, we're at that point where we have more and more information available. And is that better? Does that serve us well? Arguably, I think it maybe doesn't, because I also think it opens up the gate for like, if there's bad data, that's going to dilute even more.
It's also just more, I guess, noise. It's more noisy, right? And I mean, I don't know. There's a quote I keep seeing that's like, we have more data, but less insight, right? So great to have data, but now what?
Why?
And I don't know, maybe there's something going on the back end with all this data that it's contributing greatly to future research. I don't know. It's hard to say. I just know that like we feel it at the site level because we have to collect all that data.
I mean, have you felt that? Like you felt that you're being asked for more and more data? Or
I think, yeah, for sure. I mean, and again, my research career is not necessarily like insanely long, but 15 years ago doing studies on implantable brain stimulators, I feel like we were collecting less data than on like complicated brain surgeries than we're doing on some of these like simple outpatient drug trials, for sure. So yeah, I mean, I don't think that number is wrong, that almost 300% more data points.
Well, then it begs the question as to why are we in this position, right? Like, is it because we have a viable purpose and we think we're going to get more information, we'll be able to make new discoveries or new inferences, new insights? Or is this, again, based on our being risk adverse? So we're doing it with CYOA to be like, well, we're going to capture all of this because if we don't and something goes wrong, then we're on the hook for it.
I don't know. We'll see. I'd be curious. I don't know who can answer that question. Someone from a sponsor, someone from FDA. I mean,
Yeah.
certainly the FDA is not saying give us more. Maybe they are. Maybe they are. Yeah. Maybe we need to chase down that rabbit hole a little bit and see. Either way, it is curious, and I'm sure Ken will tell us more. I believe they're getting ready to publish some more stuff, so we'll keep an eye open for that. This one I found interesting. I think I'd seen maybe Craig Lipset post this on LinkedIn, which I thought was really cool. I'm going to just say this, that Stat News, I'm sure you guys do great work. I'm not going to subscribe, unfortunately, for $300 a year. So I ran it through an AI summarizer. So apologies. But really the gist of it is, and this is something I didn't know, and I doubt, I'm willing to bet a lot of us didn't know, is that clinical trial participation is covered under the Family and Medical Leave Act, which is pretty cool. Did you know that?
I did not, and I think it would be cooler if FMLA was a better program. It's still cool. They can't fire you, which is good, right? And you have to come back to whatever your job is. But that's pretty much what it does. Like, you can't get fired for doing it. That's what it is, right? It's protection. You can't get fired.
Yeah, in fairness, I guess that's the bare minimum you could ask for, is that please don't fire me for trying maybe not to die. Fair. The bar is relatively low, but this article is kind of a bit of an anecdote about someone who almost lost their job, or almost actually had to quit a clinical trial to keep their job. So it's at least nice to know that there's something to fall back on. And it looks like this was due in large part, or maybe entirely, due to the efforts of the Foundation for Sarcoidosis Research.
That's a super active foundation. The sarcoid population is incredibly active. So that tracks me. Good job for them, man.
Yeah, no, shout out to FSR. And that's awesome. And again, it looks like Department of Labor didn't really come out and clarify this until November of last year.
Wow.
So again, very cool. Maybe something to keep in your pockets if you work at a site and you dealing with patients who are concerned or otherwise may have problems. I think it's pretty cool.
Yeah, I mean, it's a nice buffer, especially considering how complex some of these. And what we talked about, we're gathering more and more data points, which probably is going to result in, at some level, more burden on a patient, right?
Yeah.
So if we're creating more complex protocols with more data points, it's going to be more burden on the patient, and it's already a lot for some of these particular trials, and so it's nice that they have some level of protection. Again, I have qualms with FMLA across the board, but it's something.
It's something. At the very least, you can't.
It's not bad. It's good. We got a floor now. We got a floor to climb from.
For your overwhelming stamp of approval from Denali. Great job.
I'm super optimistic and positive, so that does track.
For sure. Lastly, today, a little short episode today, it seems like. I thought this was interesting. ACRP is publishing their first ever national workforce survey. This is something I think we talked about a few weeks back. And we actually did have someone, I did get connected with someone from ACRP that we should have on and talk more about this. I think there's a little bit of a movement to sort of, I don't know the right word, legitimize, the clinical research profession. I think this is probably, a good step in that direction. So, I haven't had a chance to check out the actual results yet. But I think you guys should check it out.
It's interesting because I think we talk about, like, when people come on in the interview, and one of the things we kind of talk to folks about is, like, how did you get into clinical research? And, like, I've met no one, myself included, where it was like, when I was doing my like career assessments in middle school, I was like, I'm going to be an actress or I'm going to be a veterinarian. Like, I was never like, I want to be in clinical research. Like, I've never heard
right.
anyone who said, like, yeah, this is what I went to school. I mean, I'm sure there are. I'm sure you're out there.
There are. I feel like there's definitely a younger generation that I
Well,
feel like
that's
I've
what I'm
talked to,
saying.
but
Like,
yeah,
before, it wasn't something that was like, this is something you do. It's like maybe you do medical stuff and you like found your way, or maybe you do technology and you found your way into it.
yeah,
Whereas now, so more so, it's like, oh, this is a thing that like the general public is aware of, not just people who are steeped in it are aware of. And so, how do we like make that more established? Because live and breathe in this space, of course, everyone knows about it, but that's who I talk to.
yeah. And I mean, just some of the very like high level findings that they've published here, not within the publication itself, are interesting. That of the people in the field, 77% express confidence that they'll continue to work in the area and find it a fulfilling career, and 70% expecting to remain in the field for the next 5 to 10 years. But the funny part of that is only 33% say that trial operations are efficient, while 31% report budgets are sufficient to support good operations in their study. So a little bit of a mismatch. Like, I guess it's good, right? Like, people are committed to staying in the field, but it seems like a big number of those people also recognize that it's really inefficient and not funded well enough.
Well, I mean, it begs the question, right? Like, why are you in the field? Why do you stay in the field?
Yeah. Well, and I just an assumption on my part. I'm sure you'll agree, but like, depending on what your role is, like, it's likely that you're doing this because you actually like give a shit, like you care to try to make things better. So it's hard. It can be, frustrating, can get you down at times, but it's great that so many people are at least plan, to continue to stay enough, even though like recognizing the challenges are,
Well, I think
excited and willing to stay, keep doing it.
I mean, to me, it makes a ton of sense, right? Because like the industry as a whole is trying to solve things that don't have solutions. So like holistically, we're trying to create better treatments, therapies, etc., for things that we know are broken or wrong medically that we're trying to improve. So like that's the goal of the industry, right? I'm sure there's folks who are just in it for money, but holistically, let's look at the industry as a whole. That's what functionally we're trying to do. And so then if you look at the industry itself as something that is broken, has problems, needs a better solution, you have people who, from the larger macro goal, are trying that as the industry. So you're going to have people who have a mindset who see problems and are like, okay, our goal is to fix them and make them better. So like,
Yeah.
it makes sense why people would stick around and feel fulfilled because you're doing the same thing on multiple levels.
Right. Yeah. No, you're not wrong.
I mean, frankly, that's why I stay in the space. There's like, it's a cool space. You feel like you're doing something that's potentially good for the larger good of things. And then there's a lot of things that you can make better. So like whatever you're doing, you're probably doing something to make a positive impact if you're doing with the right mindset.
Yeah. And maybe that's I don't know, unintended thing, but like, look, unfortunately, there's a lot broken in what we do. So if you care to make things better, that means you're in a good place, because if you look to your left and then you look to your right, you're going to find problems to be solved and things to be made better. So there's no shortage of those opportunities.
Which, I mean, again, like comes into why when you go to all of these conferences, you go to the exhibit halls and you see a bajillion and one vendors, because folks are like, hey, I'm going to try to make this better. Which, like, if you look at the positive side of things, I think that's pretty cool.
Yeah, it's true. And, I like to poke fun and have fun with it. But I mean, at the end of the day, it's a good thing, right? And I think whatever you want to call it, the things that are crowded or competitive, I mean, it's going to hopefully bring the best solutions to the surface by challenging each other and, sort of testing all of these things against one another. So at the end of the day, it's net positive without question. Now, doesn't mean there still isn't some people that are doing it for money or things that are just outright wrong. Maybe even corrupt. And, there's issues, and I think those should be
I mean,
called out and
we're
dealt with as well. But
we all almost kind of replicate the problems we have as an industry as a whole, though, where it's like we're going to create all these solutions and everyone's trying to do it and like be special about it. And it's like, hey, maybe if we just like 5-10 different companies don't need to try to solve one problem. Like maybe we try to work together and collaborate. And again, I think that gets back to like ultimately like I'm trying to get funding, I'm trying to raise for this, I'm trying to do that, like, or it's ego. I think there's plenty of that too in our industry of like I'm going to be the one who solves this problem, and it's like it is bigger than any one company, is bigger than any one person. We should be working towards a greater goal together, which I know is not necessarily aligned with our economic model as a world, but hopefully we can get some semblance of there.
It's true. Yeah, and I mean, I think it's getting. Yeah, I want to say. I want to say it's getting better. I don't know. I mean, I think there is at least a little bit more of a willingness to like cross collaborate. It feels like maybe not. Again, I kind of live in my own little bubble in some ways at the site level, because the sites are very willing to collaborate with each other. I know it's a different thing, but overwhelmingly, and I think more and more sites want to collaborate and work together and problem solve as a group rather than individuals. So I think that is getting better. Hopefully that's a little bit of a microcosm for the bigger picture,
I hope so. I mean, I would say from the vendor perspective, it's super mixed. I'd say that there's certainly a good chunk of vendors who have that, like, let's integrate, let's collaborate. Like, I'm building this, let's integrate it with your thing. Like, the goal ultimately is the ultimate goal. We can do it together. Unfortunately, there certainly are big chunks of vendors out there who want to monopolize the space. Again, a lot of that comes back to the idea of doing it for financial reasons and not to actually solve the problem. And so I think that's unfortunate. I think what do you think from the sponsor's perspective? I'd say it's probably also mixed on sponsors who are willing to like work together, or is it even worse? What do you think?
It's probably worse on the sponsor side, if I had to guess, just from, again, I'm at a distance a little bit, but I mean, even looking at, how I'd posted on like the clinicaltrials.gov, and I got a lot of responses that are like, oh, well, nobody wants to share what sites they're working with. And I'm like, what? Like, that's stupid. And again, it goes back to, was it Bree who came on and was like, sites are a shared resource. Like, but they're not treated that way,
Although I will say, I mean, at Summit, my experience, at least for, and again, these are the sponsors who engaged with us on these types of conversations, so you might get some like selection bias there.
Right.
But there certainly was the ability, like, of them folks wanting to work together. Like, we brought different sponsors together, and everyone was kind of trying to work together. And so I saw that, which was cool. And again, I appreciated that level of collaboration, at least having conversations and sharing some ideas. Now, when it gets to like IP and some of that stuff, I don't know how broadly that connects.
And again, some things are never going to be
right. You can't, right? Like, we are all businesses. Like, everyone in this field, like sites, sponsors, vendors, we are all fundamentally businesses. So we need to maintain some semblance of financial security. So there's going to be some of that regardless, but I think there's a way to do both. And honestly, I think long term, you're going to be more successful from a business perspective if you do the right thing and make the right choices. Like, short-sighted, you might have a great exit and your C-suite gets tons of money and pieces the fuck out. But long term, if you're looking at the long-term growth of the company and the long-term goal of the vision, I think if we work together, it's going to be better for everyone.
I agree. All right. Well, that's pretty much it for today. Anything else you want to tack in? I think next week we may not. I'll be at SCRS next week.
Well, I'll be at SCRS too.
Oh, that's funny. Okay. Well, maybe we'll see if we can do something
live or something.
SCRS.
Yeah. That'd be fun.
Sure, you'll be manning your booth, but
I'll be in orange.
Of course, that's like a bad color here in Oklahoma, because the two colleges, and one wears orange and one wears red, and half the state hates orange.
See, I'm not mad at orange. I feel like it's okay, like, with my complexion, so I'm not mad at it. But generally, I mean, it's a departure from my normal like black, whites, and grays. So that's fair point. Really stretching the limits there. Yeah. Great job. See how dedicated I am. Exactly. Yeah. You're welcome, Viva.
Cool. All right. Well, thanks, guys, and
Maybe see you next week. We'll connect. We'll figure it out.
All right, we'll figure it out. Either way, thanks, guys, and take it easy. Thanks for listening to Note to File. We're committed to continuing to bring you independent and unfiltered coverage of the clinical trial industry.
We want to talk about what you want to hear. So if you have something on your mind, hit us up at notetofilepodcast.com.